Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer reminder that I always like to go over is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. As we continue our antibiotic series, we are about to the end of pediatrics. And like I said on the last video, after we go through this, like just straightforward knowledge based system by system antibiotic treatment, I will then start to present questions to you guys in a more detailed fashion where you're having to um, look at those assessment findings and determine the diagnoses and then the treatment so that you can see it on a larger scale that way also. But I wanted to strengthen that knowledge muscle before we went into a more detailed application process. All right, so question number one for today. The nurse practitioner has diagnosed the pediatric patient with an uncomplicated UTI. What are the best first line treatment options at this time? Select the best two. Is it A, Bactrim, B, doxycycline, C, ciprofloxacin, or D, nitrofurantoin? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question. I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you. Stem of the question here states, what are the best first line treatment options at this time? Select the best two. Now, y'all know on the ANCC, you do have the options of select the best two, select the best three. Those are the type of select alls. And I always tell people, because I know we generally don't like those select all that apply, but I tell people I feel like these are better because NCLEX style select all that apply is like you don't know if it's one, none, or all of them, right? But with select the best two and select the best three, how the ANCC does it lets you know that specifically how many you need to select. Okay, so here select the best two. Again, I always say if the stem of the question is asking you for a treatment, you need to run it back and see if they've provided you with a diagnosis. And if they have not, run it back a step further and look at those assessment findings to determine the diagnosis. But here, this is a pediatric patient diagnosed with an uncomplicated UTI. So the best two that you can treat with as a first-line therapy for pediatric patients is your A, Bactrim, and your D, nitrofurantoin. We know nitrofurantoin, aka Bactrim, is first-line therapy in adults as well as in children. Bactrim is also. I was just talking about this with someone in a one-on-one session yesterday, and we know that macrobid is one of the top of the first-line therapy. I think of it like hypertension. It's a group of first-line therapy options. These two are your first-line therapy option for the kiddos. Um, on boards, they will not put both in a scenario because there's no definitive way to pick one versus the other. I will say in practice, commonly they use Bactrim a lot more just because people have utilized that a lot in the past, but you deal with a lot of components with this, sulfa allergies. There's more side effects associated with Bactrim. So it's really like a preference. So they will never on boards give you both of those. Um, Either they're going to say one or the other for potential first line treatment options. So I just wanted to make you aware of both of those as those options. But and macrobid is top of the one, simply because it has less side effects. But there's no specific guideline saying picking one versus the other. All right, question number 2. The nurse practitioner has diagnosed the pediatric patient with uncomplicated UTI who just completed macrobid a week ago without success. The patient has an allergy to sulfonamides. What is the next best treatment option at this time? Is it A, augmentin, B, Bactrim, C, clindamycin, or D, amoxicillin? Take a moment and tell me what you get. All right, so here the stem of the question states, what is the next best treatment option at this time? All right, so again, when they're asking you about treatment, you want to see what the diagnosis is. Here it is a pediatric patient with uncomplicated UTI. But also it says what is the next best. So that lets you know that, all right, there's something going on and we need to consider the next option to do, right? So let's see what other details we need to gather to see why we're utilizing something next now. You know what I mean? So it says who just completed macrobid a week ago without success. All right, so just like we just spoke on question one, we know macrobid and Bactrim are our first line treatment options. So appears as though we have come in, been diagnosed with uncomplicated UTI. Macrobid was utilized and it was not successful. So we need to consider a second line treatment option, right? The patient has an allergy to sulfonamide, so you can't, go with Bactrim because when you have multiple first line options, oftentimes if one doesn't work, you can try another. But in this event, they're allergic to sulfonamide, sulfamide, so we don't want to give the Bactrim at all. So you need to move to your second line therapy, which is augmentin. So if you're looking at it in an algorithm form for our pediatric patients with uncomplicated UTIs, we start with either macrobid or Bactrim. And in the event that the treatment fails and you can't utilize any of the first line, our second line is augmentin. Okay. All right. In question number 3, the nurse practitioner is discussing third line therapy options of pediatric patients with uncomplicated UTIs. What is the correct third line treatment option? Is it A, penicillins, B, Bactrim, C, macrolides, or D, cephalosporins? Take a moment and tell me what you got. And here the stem of the question is, what is the correct third line treatment option? So we're still talking about uncomplicated UTIs and just discussing the third line therapy options. The best answer is D, cephalosporins. So again, to see that full picture, if you're starting from the top, the first line options are your macrobid and your Bactrim. If you need to move to a second line, it's augmentin. If you need to move to a third line, it's the cephalosporins. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in the ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, I do offer a self-paced review course virtually for family and adult Gero. It's linked in the bio of this channel. If you would like to do practice question, all of my QBank options are also linked in the bio of this channel. My website's also linked there that houses all of these things. And then lastly, if you're looking to book a one-on-one session, I always say just reach out to us as I customize all of my one-on-one sessions. So I like to speak with you, engage what you truly need so that I can tell you which option best fits your learning needs at this time. Okay. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.